Micah Guidry. I am the manager here at Cosmetic Surgery Center, and I am also Dr. J's assistant.
Hi, I'm Dr. J. Appurao. I'm also the owner of LaBelle Center for Cosmetic Surgery. I'm board certified in general surgery and diplomat of American Board of Cosmetic Surgery.
Today's webinar is pre-recorded, so we want you to feel free to chat with us. If you look at the bottom right hand corner of your screen, we are available throughout the whole webinar, so we would love to hear your feedback, your comments, any questions that you have, and we will answer them quickly. So one myth that we hear is cosmetic and plastic surgery are the same. However, cosmetic surgery deals with enhancing your already natural beauty, whereas plastic surgery deals mostly with reconstructive surgeries, but they can also do enhancements as well.
Cosmetic surgery and plastic surgery are somewhat different. Plastic surgery includes some aspects of cosmetic surgery. However, plastic surgery is more involved in reconstruction of, for example, lost breast tissue after mastectomy or accidents, skin grafting, tumor removal, and so on. But cosmetic surgeon focus entirely on cosmetic surgery alone, that is, enhancement of the appearance, which is otherwise normal.
Myth number 2 is that cosmetic and plastic surgery are dangerous. The fact is that the FDA has assessed both cosmetic and plastic surgery over the years, and were deemed generally safe. What that means for our patients is that being in the medical field and being a professional, whether you're a surgeon, a staff member, a nurse, whether you work in surgery, any part in dealing with our patients is so highly regulated that the safety of our patients is our first priority.
I agree with you. Cosmetic surgery once upon a time used to be very dangerous indeed. There was a time we used to do a lot of blood transfusion for patients who underwent liposuction. That's a long time ago gone. It's past history. Scientific improvements and technology has come so far. Today, cosmetic surgery can be done extremely safely with no blood transfusion, local anesthesia. The patient walks in and walks out. It's that simple. Also, when people do cosmetic surgeries add-ons such as breast augmentation, adaptive tummy tuck, adaptive facelift all at one time, the level of danger certainly does increase. In our facility, we make it a point not to do such things. We can always separate it, do the least we have to do with the most safety to get the most acceptable results as quickly as possible. We are very careful about it. We have to compete with lots of plastic surgeons, lots of other surgeons competing with us. And being a freestanding facility, we have to be even more careful.
One thing that we like to tell our patients too, we get a lot of questions about mommy makeovers, and I would only have 2 weeks off and I want to get so much done. But what we tell you is, what's your first priority? What's more important to you? And we go from there because we spend a lot of time with you talking about each procedure, the recovery time, and what that means for you as a patient. And later on, when you want to do more, then we can discuss more options at that time as well. So myth number 3 is that silicone breast implants are dangerous. However, the fact is that there is no scientific evidence supporting this myth.
As you may be well aware of, there are many years of lawsuits have been drawn on patients who use silicone breast implants in the past. And over the many years we found out that all of that so-called facts about medical illnesses caused by silicone breast implant leakage has been proven to be false and untrue. Imagine this, throughout those years when there were lawsuits going on for silicone breast implants, cosmetic surgeons have been injecting free silicone into the lips all along. There was no lawsuits, there were no diseases at that point. So just to know that. Also, the rest of the world has been using silicone throughout the whole time. One of the good things about those lawsuits is that because of that, the companies have come up with a better form of silicone breast implants, which are far better than the ones we used to use that leak like water. Today's silicone implants, when they get injured, they don't leak like water, they're like gels, in droplets of gels. They don't leak and cause any real problems. Sometimes it's not even easy to know it's leaking or not. In any case, silicone implants are coming back rapidly into vogue. Of course, we can still do saline implants if you worry about it.
Myth number 4 is that the fat comes back after liposuction surgery. The fact is, it does not come back after we remove fat from certain areas. However, we do stress to our patients to maintain your weight after surgery and your lifestyle, because when you do put on weight again, what's going to happen is it's going to multiply in all the other areas that we did not do the liposuction on. So an example would be if you had liposuction surgery on your lower abdomen, your hips and your flanks and your waist is going to double in size if you gain weight after the surgery. So we do stress that a lot to make sure you work out, make sure you eat healthy, and just, you know, you paid for this procedure. It was an elective surgery, so enjoy it. And another thing that I think we stress a lot to the patients is that this is not meant to be a weight loss surgery, nor is it a cellulite reduction surgery. And I think we hear that almost in every consult, so we want to address that right away.
Just imagine this. Suppose you have a cup of fat and I take half the cup out. The rest of another part of the body, they have another cup of fat, and I don't take anything out. And if you put on weight twice, let's say another 50%, the cup that's already full will become 150%. The cup that's only 50% will become 75%. In other words, what's left there still, the fat cell that is still left in the body will multiply, but what's gone is gone for good. So after the liposuction, the part that puts on weight is going to overpower the area that the liposuction has been done. And that is not a very pretty sight. So most of our patients really have a very good incentive to keep up with their shape, going to the gym and doing exercise and having a good diet program after this. Their life changes after this.
Another common question that we hear from our patients is, do I have to be a certain weight to have liposuction surgery, or do I need to look a certain way? And the best way that we answer that is, no two patients are alike. One weight for somebody can be too much, and for the next person it's too little. So the best thing to do is to come in for the consultation, let us talk to you, let us see what areas bother you, and at that point we can determine if you're a candidate for liposuction surgery or if you need to have weight loss surgery. So there's a lot of different factors that are involved because each patient is so different.
Yeah, I think the point is very well made. Particularly I would like to tell you about people who are morbidly obese. A lot of them believe they can lose weight by liposuction. That's not true at all, number one. Number two, a lot of the people who are morbidly obese, they would like liposuction, theoretically and technically possible to do liposuction. However, it may be very dangerous on them. Whenever people are morbidly obese, the whole body is suffering through so many other problems. When the BMI, that's called body mass index, exceeds the limits, it's better that one goes looking for weight loss surgery and lose weight to an ideal level. And then cosmetic surgery can be performed safely to correct the problem that will come after that.
So the opposite side to this is, once we do liposuction surgery, we don't necessarily have to throw the fat away. Today's advancements in science allow us to inject the fat into other areas that a patient may be deficient. Dr. J, we normally do face fat transfers, breast, and what else?
For example, the fat that we take out can be injected into the face, into the breast, into the buttocks, and to augment it. And also, we can also use it for many areas, surgically or by accident deficient, make that part of the body part look natural again.
Myth number 5 is that recovery time is 3 weeks to a month for all of our cosmetic procedures. However, the fact is every procedure is different and every patient is different. Recovery to one patient may mean staying in their house for 2 weeks and not letting anyone see them, but the next patient may be totally comfortable with going out and about the next day, not looking their best, but feeling comfortable. So it really depends on the procedure. It depends on what we're doing and how the patient's lifestyle is affected. I think we see a lot breast augmentations and tummy tucks. The main concern on the medical side is patients with little kids or heavy lifting jobs. That's definitely something we want you to steer away from. Kids tend to jump on you and want to hug you, and that can be dangerous. And lifting and straining is dangerous. But our facelift patients, I think they go a Thursday they have their surgery, and by Monday they're pretty comfortable and ready to go back to outside activities. I think it just depends on the patient, really.
What you said is right. Recovery means different things to different people. For example, every recovery has two sides to it. One is a medical side. That means if I make a long cut in the belly, that's going to have to take some time to heal. There's not enough strength for you to go do things and it'll tear open. Same way, there's a big cut in the face. You cannot sweat over it, you'll get infected. And the other side of the coin is, once the healing part is taken care of, you can walk around, do whatever you want, as long as you yourself do not feel uncomfortable looking the way you look in public. Now, a lot of times, some of our patients who we do breast augmentation on, they're completely covered, they're wearing a special bra, and nobody even knows they had surgery just yesterday. So they're going to work like that. So it's very different for different people. But medically speaking, approximately 2 weeks is usually good enough for most people.
So just a quick reminder, we are on live chat at the bottom right of your screen, so please flood us with questions and comments. But moving on to myth number 6, is that wealthy people are the only people that can have these procedures done. The fact is 70% of our business comes from middle class men and women, and these days these procedures can be financed as well. There's so many different medical companies that have come out with financing options that are in some cases interest-free. So we're seeing a definite influx in that.
Yeah, I agree with you. Cosmetic surgery used to be only exclusive for very wealthy people, just as recently as 15-20 years ago. But the cost of cosmetic surgery has come down a lot because there are so many people doing surgeries, number one. Number two, medical advances have come a long way to a point we are sending patients home the same day. The same patient used to stay in the hospital for a week in the past. So there are many differences like that that have made the cost of the cosmetic surgery has come down so far it's affordable to almost any person. Now if you imagine that an ordinary simple surgical procedure or not even non-surgical procedure, staying in the hospital for 1 day may cost more than any cosmetic surgeries we do here.
Myth number 7 is that people who consider cosmetic or plastic surgery have psychological issues or have major insecurities. However, the fact is, today everyone wants to have a better quality of life. Everybody wants to feel better about themselves. And for that reason, almost every ordinary person walking around has had some form of cosmetic enhancement, whether it be surgery or non-surgery. And it's very common these days. And when they're doing it for the right reasons for themselves, then it's a perfectly normal surgery to have.
Yes, I agree with you. It used to be a taboo not too long ago to have these cosmetic surgeries, and people look at you in a different way, knowing that you had a cosmetic surgery. However, the social atmosphere has changed a long way, and it is not psychological insecurity that brings them to having this done. Ordinary people have it done, and they become better people simply because they value themselves better, they look better, they're able to project themselves better in many different ways in the public atmosphere. And in many ways, it's a self-improving thing. However, you do not do this for that purpose. In other words, you do not want to do a cosmetic surgery because you want to go up in the scale at your workspace. You want to do it because you're going to feel good for yourself. You don't do it because your husband wants a bigger breast. You do it because you want it. You don't want to lift up your breast unless you feel heavy with the breast, or sagging breast makes you look below standards. So there are many things about it. The person who seeks surgery is not crazy. The person who seeks surgery is smart to go, feel better about herself soon.
So we just wanted to take this time to thank everyone for watching this webinar today. We hope that we were informative and helped you better make a decision for your future procedures. And please feel free to call us. Our phone number is listed at the top right of this page. And continue chatting with me if you have any more questions.
Don't forget, when you come for a complimentary consultation, it'll be directly with me, and you can ask me the questions anytime you want. Thank you.
And our consultations are free. Thank you.